Much, Dow. So if you or someone you know has ever had kidney stones, you know they're no laughing matter. So what can you do to avoid them? Trust me, you'll want to. Here with more, Dr. David V. Ludlow with Urology Specialist of Nevada. How are you, Dr. David?
I'm doing great. Thanks for having me back, Sean.
I'm glad we get to talk about such fun topics.
Oh, yeah.
Kidney stones.
Last time we talked about prostate cancer. I think today's topic includes a little bigger demographic.
No question.
Anybody, any age, any gender can deal with kidney stones, so I'm happy to be here.
My father had kidney stones before. He says the worst pain he's ever felt in his life. Explain what kidney stones are and what causes them.
So kidney stones, obviously the kidneys are what creates and drains the urine from your body.
Yeah.
There's always some crystals that form, but in some people they might form more crystals than normal, or else their body doesn't do a good job of flushing these crystals out, and that's when they can kind of coalesce and form into these stones that can then wreak havoc.
Well, we do have a picture of this. They do not look. Look at that.
Yeah, it's like they have little spikes. They're just there to torture you. So you could understand trying to pass that down this little tiny ureter, which is the tube that drains the kidney into the bladder. That's where the pain comes in.
Mm-hmm. How do we stop that from happening?
Well, it's a good question, and it's amazing because we're doing a lot of research to try to prevent them.
Of course.
And there was just a recent review, and in the last 30 years, the prevalence has tripled of kidney stones.
So there's obviously something.
So we're obviously not doing a great job, and I think the biggest culprit is Western diet and lifestyle. Not drinking enough water, too much sodium in our diet. There's also been a lot of links to obesity and diabetes, and so as these are increasing in prevalence, so are kidney stones. So
I heard soda drinking can also cause this.
Yeah. So obviously not all fluid is the same.
Of course.
That's why we always encourage water intake. But soda has a lot of ingredients, especially caffeine, coffee, tea, alcohol, things that act as diuretics. Even though they make you go to the bathroom more initially, then there's a period of dehydration afterwards, and that's when these crystals can kind of then form these stones.
Wow. So how harmful, I mean, we know this is painful, but how harmful is this to the body?
Yeah, well, the pain itself can be very debilitating and prevent you from being able to go to work, and a lot of times it's associated with really bad nausea that can lead to more dehydration.
Yeah.
In certain situations, what happens is when it drops down to the ureter, your kidney gets swollen trying to push against that pressure.
Yeah.
So
it's almost like a dam. Yeah.
Yeah, exactly. And over time, if it's not treated or if the stone doesn't pass, it can cause irreversible kidney damage.
Wow.
Sometimes you can also get bacteria build up behind the stone, and in certain cases, people can get really sick, and even have to go to the hospital, go to the ICU, and sometimes even die if they're not treated. So it's more than just pain sometimes. These have to be addressed and treated appropriately and quickly.
How does living in a dry desert affect this? Is there any effect whatsoever? Or?
There's definitely an effect. If you kind of were to draw a line across the United States and head south, we sometimes call the south the Stone Belt.
Oh, no.
So obviously living in Las Vegas, things are already starting to heat up, and it's good job security for me, obviously living out here as a urologist, but there's definitely been research showing that hotter environments or people that spend a lot of time outside, whether with work or exercise, are more prone to develop stones.
So what are there symptoms that we should look out for? I mean, obviously bad pain around here.
Yeah, well, usually the pain actually starts kind of in, depending on what side the stone is, underneath your ribs back here is where the kidney is.
Oh, wow, okay.
And that's because that's when the kidney gets swollen. It starts causing pain there. And then it can transition as the stone starts to pass down your ureter. You start having kind of lower abdominal pain. Mm-hmm. A lot of times on the right side, this pain can be misinterpreted as a possible appendicitis. So obviously a CT scan would clarify what's causing that pain. As it gets close to the bladder, a lot of people think they have a urinary tract infections because they feel like they always have to go to the bathroom, and sometimes it hurts to go to the bathroom. Usually once it makes into the bladder, it's home free at that point, but they can also cause blood in the urine. When that kidney gets dilated, it can cause a lot of nausea, and that's what often takes people to the emergency room. And like I said, in those few cases when bacteria get built up behind it, you can even have fevers or chills.
We got about 45 seconds left. Let's talk about treatments. I mean, one thing that can't happen is you can't just pass the stone, which is no joy, but once it's done, thank goodness.
Yeah, ideally is to pass it on your own, but sometimes the stone is too big or for whatever reason isn't passing, but we can give you medications to try to facilitate that. Sometimes we have to do some minimally invasive surgeries. We can go up with a tiny telescopic camera and zap it with a laser.
No kidding. Wow.
We can even less invasive with that. Sometimes we can use these high intensity shock waves and fragment it using X-ray vision to help us.
It's like human body fracking.
Yeah, it's really interesting. And for really big stones, sometimes we actually have to make a little tube directly into the back, and then we can put instruments and cameras through there and treat them. So,
the technology's come a long way.
Unfortunately, most of the time there's not a medication that will dissolve them. So either you got to pass them, or we got to go in and treat them. And as much as we enjoy treating them, if people can improve their diet and prevent them, I think that's better off for everyone.
No question. Doctor, great having you as always.
Oh, thank you.
Thank you so much. Urology Specialists of Nevada. They have 3 convenient locations around the valley. If you'd like to find out more, just head to the website or call the number on your screen. They're also on Facebook and Twitter. Up next.